hopefully that will be okay. We're here for an hour and a half to talk about impact measurement in the charity sector, specifically what trustees need to think about in terms of impact measurement. So it's a webinar. We have 3 speakers, including myself. Then we have Nazmin, Akthar, and Jenny North speaking after me. And I'll introduce them as we get to them. If you've got questions, we have plenty of time for questions at the end, but also after each speaker, we'll have 5 minutes or so just to any specific questions you have for them. And you can ask questions either in the chat or in the Q&A function, probably best in the Q&A function. If I could ask you to make sure your screen name is showing so that we can see both who you are and your organisation, ideally, if you have one. You can watch a live transcription or subtitles by pressing the live transcription button. We are recording the seminar so that you'll be able to watch it afterwards, but so will other people. We'll be sending a lot of the materials that you see afterwards. You'll get the slides afterwards and a link to the recording. And you'll also get sent a survey, of course, afterwards. And we're very grateful for the Clothworkers Company supporting these seminars, which have been a long-standing thing that NPC has done with Clothworkers. They were all face-to-face until a couple of years ago and now predominantly online. And we do have another one coming up in May, which is on diversity, equity and inclusion. So I'm just going to check the chat before we... So thank you for those who put in their names and where they're from in the chat. That's good to see. I'm just checking that we're expecting about 100 people signed up, so we've got 55 so far. I'm going to get started, I think, in a second. Just going to wait for a couple more. Okay. Oh, I've gone ahead of myself here. Right. Well, thanks so much for joining today. My name is James Noble. I'm the Associate Director for Data and Learning at NPC, the Joint Associate Director. I'm also the trustee of a charity called the PSP Association, and PSP is a neurological disease, and the association looks after people with that disease and funds research and campaigns to raise awareness about that disease. And with NPC, I spend most of my time helping individual charities to think about the impact they're trying to achieve and how to measure that impact, which is the focus of today's discussion. I thought we'd begin with a little bit of context on the Charity Governance Code, which is a guide to charity governance for those who are involved in it, and to see what it says about impact and impact measurement. And it doesn't say an awful lot. It has a go at defining outcomes and impact, which you can see here, and then says that boards need to lead the development of and agree a strategy or plan that aims to achieve the organisation's charitable purpose and is clear about the desired outputs, outcomes and impacts. So the expectation is that the board will have a good understanding and clarity about what it's trying to achieve. And then 1.4.2, the board evaluates the charity's impact, outputs and outcomes on an ongoing basis. So that's quite a broad statement. There's not a lot of detail, and it doesn't tell you what you should do with that information or how you should use it. It gives you very little, except to say that you ought to be doing this sort of thing. So that's quite interesting context. And so what I'm going to cover in my part of the talk is a few thoughts on how to respond to this, on how to, as a charity board, to approach impact measurement. Then I'm going to talk about a little bit about doing a theory of change, which is really the response to the first of those bullet points about having a plan for achieving impact. And then I'm going to talk a little bit about a measurement framework and our 5 types of data approach, and conclude with a few tips on how to do it and some thoughts on reporting impact. Let's begin by thinking about what impact actually means. And we at NPC are keen on quite a precise definition of impact, which is it is the sustained effect of an activity on individuals, families, communities, or environments, i.e. the lasting effects. And developing that a bit further, there's a few bullet points here, which I think are really important, actually. So impact is about your beneficiaries, not your organisation. Seems obvious, but doesn't always come across. But impact is about the effect you want to have. It needs to be something important, meaningful, significant, and some examples there. It's long-term, and often it's something that you achieve after your program or your work is done. You can think of it even as your legacy, what's lasting. A point which I think is really important is that impact is achieved out in the world by people themselves, by communities. What we're doing as charities is supporting people, giving them attributes and assets to help them achieve that impact for themselves. And as such, you're not likely to cause impact alone. In almost all cases, any positive impact is achieved both through your own charitable work, but also through that of others, including that of the state. And because they're significant, we recommend that charities aim to have as few impacts as possible and try to be really clear and precise about what those limited impacts are. So that's our suggested definition. And then we can ask ourselves, well, why is it important to measure impact? And we think there are generally four main reasons. The first one is money, and this is what drives a lot of impact measurement in the charity sector, the sense that you need to show you're achieving impact in order to raise more funds to justify the funds that you're spending. So that is important. The line, top right, represents pride. So impact measurement is important for assurance, really, that you're achieving what you say you're going to do, and taking pride amongst staff and volunteers that you're making a difference. The third point, at the bottom left, the little people, represents the fact that impact measurement is about giving people the opportunity to say what they think about the service, about being accountable, and even the kind of moral dimensions bits that you very much ought to seek people's opinion whenever you're trying to support them or change the world for the better. And in the bottom right-hand corner is the need to improve, to do better, to try and achieve more for the people we're trying to serve. So those are the four main reasons for doing it. But it's difficult. And depending very much on what you're trying to achieve, and the charity sector is hugely diverse, so this means a lot of different things at different places. If the impact is the sustained effect of an activity, then that is actually very difficult to measure for these obvious reasons. So first of all, if impact takes time, then you need to have data capture going way into the future. You need to have methods that will enable you to find out what happens to people. And if impact has many causes, then you need to have data that helps you unpick those causes and unpicks the role that different people play in achieving impact, which is very difficult to do. And if we talk about measurement, then that means impact has to be quantitative, which means you have to do this kind of this data collection quite a long time into the future and at a large scale. So that's why charities find impact measurement particularly difficult, because it is inherently difficult. Alongside these inherent challenges, there are lots of other more day-to-day challenges around impact measurement, which we list on this chart here. I think in particular, having the resources, the skills, the time, the money to be able to do it is important. Having the expertise, knowing what to do with the data and ensuring data quality. These are all quite important challenges that every charity faces. And as such, whenever you ask charities how they feel they're doing on impact measurement, they tend to be fairly they identify a need to improve. So this is taken from a survey of charities done quite a while ago now, 10 years ago. But we asked them to say, on a scale of 1 to 10, how they rated their current capacity and capability to do impact measurement or to do evaluation. And the average score was about 4 or 5 out of 10. So the sector as a whole, and I don't think this has changed very much in the last 9 years, the sector as a whole doesn't feel particularly confident about its impact measurement. in terms of how to respond to this challenge, I think a key thing is not to imagine that there is an easy solution, that there is a particular quick fix or method that you can use that will take you to the summit here. And actually what we're talking about with impact measurement is lots of different initiatives and endeavours and projects you need to do to answer these important questions. And some of these methods in the yellow boxes I'll be talking about shortly. And another, I think, important point to make is that it's better actually to think about impact measurement in slightly more broader and relaxed terms, in that it's not just about measuring the long-term difference you make amongst your communities, but actually more usefully, you can think about it as measuring these three different things, which are the questions raised by results-based accountability. But how much did we do? The outputs that we achieved. How well did we do it? How good was our delivery? And is anyone better off? So that's a broader way of thinking about impact measurement. And I think a better one, because those early questions, how much did we do? How well did we do it? Are very important and very useful to answer. And they're also easier and more achievable to get data on. And the question, is anyone better off? The difficult question, the impact measurement question, is perhaps a question we kind of reserve for more occasional and higher quality research. So that's, I think, the best way to think about impact measurement is in asking these three different questions. So then in terms of how to go about it, and we don't have long here, we only have 10 minutes or so, and there's a lot to say. So we'll be, to some extent, skipping over some quite important issues, but hopefully this next section will be at least useful in pointing you in the right direction. So theory of change is our recommended place to start. So whenever you're thinking about impact, it's always good to have a sense of what you're trying to achieve. And this is what a theory of change does. It's a process for thinking about and describing your project, your program, or your organization. And it's taken off in the charity sector over the last 20 years or so. So it's terminology that you're probably familiar with. You might have seen it referred to as other things like logic modeling or outcomes mapping or things like that. It's essentially pretty much the same approach, whatever you call it. And what we're trying to do here is create the link between the activities that charities do, i.e. mentoring, and the impact that the charities are trying to achieve, i.e. reduction in youth unemployment. So what we're doing with the theory of change is filling in this gap. How exactly does mentoring lead to reduced youth unemployment, and how exactly is your charity going to achieve that? So that's what the exercise is about. And this slide just summarizes what a theory of change involves. I won't go through it in detail, other than to say that a theory of change is usefully divided both into the process, i.e. how you go about doing it, and that process ideally will involve lots of conversations with your staff, with your volunteers, with service users themselves, all orientated to understanding what's going on in the world and how the charity is planning to achieve the results that it wants to achieve. So that's the process. And then the output is often summarized, as this diagram suggests, as a diagram. And what you're trying to do here with the diagram is to articulate, to describe as succinctly as you can how you think the service will have an impact, so that you can then test that thinking against the evidence that's available. So you can see it as two sides of a coin, and that testing is the impact measurement side. So the first side is the theory of change, and the second side of the coin is impact measurement. And just to give you an example from the charity that I'm a trustee of, this is the very high level theory of change for the PSPA Association that we did a few years ago now, but it's still relevant. And it describes in a small number of boxes what we're trying to achieve with people, for people with the disease PSP. And just to look at the top here, we've got the goal of helping people to understand their condition and the support that's available to them, which we think will help them to make informed decisions and feel confident about managing the condition, and which we think will help them to access their entitlements, which we think will help them to live the best life they can. So what you're seeing here is a fairly brief statement about what we're trying to achieve. And then once we've got this, we can start to think about which stakeholders we need to engage with to make this happen. And just picking the box at the top left here, understanding their condition. We've identified GPs, NHS, local authorities, our own organisation and other charities as potential stakeholders in helping to achieve that goal. And then once we've got this, we can then start thinking about each of those stakeholder groups and what we want to achieve with them. So this is just an example for GPs, and it's a simple sort of logic model diagram which describes how exactly we want to work with GPs, what is our goal in terms of improving GPs' awareness, and what are our activities to do that. So what you're seeing here, what we're building is a detailed plan of action for the PSP Association, and specifically our work with GPs. And now once we have that, we can start to think about how we're going to measure it. So that's what a theory of change is all about. And this is how we answer that first point in the governance code, having a plan for what you're trying to achieve and the outputs and the impacts that you want to see. So that's the first side of the coin. And then moving on to the second side of the coin, a couple of things I want to say here. This is Interimpact measurement. First of all, something that charities don't always do enough of, which is to deploy the existing evidence base. So in academia and in government research, there's an awful lot of evidence which is relevant to the things that charities are interested in. So the first thing you need to do when thinking about impact measurement is to look backwards at the evidence that already exists. So evidence about the need in the community, what problems we're trying to address, evidence about the target group, the people we're trying to reach, and evidence about what has worked before. So all of these things are very relevant to your theory of change. And then once you've done that, you can start to look forwards at the evidence you need to collect to understand your performance and how to improve it. And then just an illustration of how looking backwards is helpful to organisations. A lot of the academic evidence that's out there will essentially support the thinking in your theory of change. So if you're a health charity and you're trying to promote physical activity, you don't need to demonstrate that physical activity leads to improved health. And similarly, you don't need to demonstrate that parental engagement in schooling leads to higher attendance. There's plenty of evidence out there which supports that link in your theory of change. So looking at the existing evidence base can help you to hone in on the questions that you yourselves need to answer. And typically for charities, that's actually more about your own performance, your own reach, your own how people perceive you. So you can focus on those things rather than these more kind of complicated academic questions. So that's the use of the existing evidence base. And now we're looking forwards at what data you need to collect. And here's our 5 types of data framework. So what we do, and we came up with this about 3 or 4 years ago, and at NPC, we now use it routinely for thinking about any charity or funder that we're working with and what questions they need to pose. And it's 5 categories, and I'll run through them quickly. But first of all, you've got user data, which is the characteristics of the people you're trying to reach. So if, for example, your program is targeting people who are lonely, you want to check that you're reaching people who are experiencing loneliness. Engagement data is then how well you continue to engage those people. Do they come back? How long do they spend with you? And what's the quality of engagement like? Feedback data is asking people what they thought of your project, whether activities were experienced in the way you intended, what was quality like, how did they rate it, how could it have been better? So those sorts of questions. And what we argue is that those 3 things, user engagement and feedback data, are things that charities should be always collecting. They should be collecting that routinely because it's part and parcel of providing a good service. And then we move into outcomes data. So these are the shorter term changes, in particular around knowledge, attitudes or behaviours that you want to convey in people. And these things are a little bit harder to measure. And so we suggest that you tackle these occasionally. And then at the end, we have impact data, which, as I said before, is the long-term change that you're trying to achieve. And this is particularly difficult to measure. And so we argue that charities should be doing this more exceptionally and not routinely. If you're thinking about your own impact measurement, we suggest going through these questions and thinking about what data you might be able to collect under each heading and what you really need to collect. What's going to be most useful to you? What questions do you want to answer? The next slide just shows you how these 5 types of data divide between different types of methods. And you'll be using some of these yourselves at the moment. Quite commonly, charities use surveys or sign-up forms, but there may be some methods in here that you're perhaps less familiar with. And the overall tip here, the first of 3 tips, is the line, no stories without numbers, no numbers without stories, which is basically getting at the point that you need both quantitative and qualitative information for different purposes. On the next slide, tip 2 is to think about sampling. And the key point here is that if you're working with 100 people, you don't need to ask all 100 of them how they're benefiting or how things have changed for them. If you take a reasonable sample, you can generalize on the basis of a sample, so you may only need to interview 10 or 20. And this is a good way to minimize the costs and the resources involved in impact measurements. We think a particularly good model for charities to think about is collecting a little bit of data from everyone. So maybe user data or engagement data from everyone, i.e. whether people show up, whether they stay involved, and making sure that everyone has the opportunity to feedback. But then to collect outcomes and impact data from a smaller number of people. So the harder questions you ask from a smaller number of people in greater depth. And that's quite a nice balance between in-depth research and quite light touch research, and we'll give you the data you need. And then tip 3, just quickly, is to get help. There's an awful lot of resources out there, which this slide summarizes. In our observation, the charities that do this the best are the ones that are connected and talking to people, talking to other charities who are doing similar sorts of work, talking to academics, talking to people like NPC, and just getting a general all-round sense of what's available and what's out there to use. So we move on to what to do with the data. So just a little bit on reporting. It's helpful, I think, to divide your reporting into sort of 2 frequencies or 2 channels. Most boards these days want dashboards or some kind of regular reporting. This is a little bit of thinking about what goes on those dashboards. Essentially, it should focus on those first 3 types of data: user engagement and feedback, what's going on, what are our early indicators of performance, how should we reflect on those. And there's some pretty clever software these days that's free that you can use if you can get to grips with it, that you can put all of this data into and get fairly regular dashboards out of it. And that should satisfy most boards if they're getting information directly and quite quickly from the front line. So that's one stream of reporting. And then the next stream of reporting is more occasional stuff. So this is back to the PSPA Association again. And every 5 years or so, we do a survey and we ask our users, our members, how they're getting along on each of these things in the theory of change. And that's really helpful for us because it tells us where things are going well, where things are going badly, as well as gives us information about our own performance. But we can only afford to do that every 5 years. So it's much more occasional that we get this kind of data coming in. And then we might even think about doing an impact report occasionally. So as a final bit of thinking, if your charity is thinking about doing an impact report, these are the kind of key headings that we would suggest focusing on. So what's the problem we're trying to tackle, which is the issue out there in the world that you want to address, how you're going about it, which is your theory of change, what your evidence says, which we've just talked about, the quality of your evidence, and then how are you learning or improving? And that's a really important point that's often missed out, is how is your charity benefiting, changing as a result of the data and learning that you're collecting. Okay, so just to summarize what I've said, so impact measurement is a challenge. All charities struggle with this, some more than others, and it depends quite a bit on your circumstances, what you're trying to achieve, how much ambition you have. But even in the best situations, the best circumstances, there's very, very, very unlikely to be any kind of easy solution. And there's certainly not one that applies to everyone across the sector. The quick wins here are to describe the change you want to achieve and how you will do it, the theory of change. So if you've got a theory of change in place, you're sort of halfway, you're a decent way there. A theory of change will help you to think about what data you need to collect. It will help you to communicate to external audiences, including funders. But the process itself will also be valuable in terms of building your team and helping you to address important strategic issues. So that's really where we would start. And we'd also encourage you as far as possible to take advantage of the existing evidence base. What's out there already that helps you to think about and supports your case. And then in terms of data collection, the other side of the coin, you have to think carefully about this and collect what's most important given where your organisation is at, which is quite a glib thing to say, I think, but what we would encourage you to do is to think about the key questions you have and think about the decisions that you're likely to have to make over the next few years, and then think about what evidence will help you make those, what will help you to make the best decision possible, what evidence will inform those decisions. And generally speaking, the easier questions to answer and the first ones to approach are how much did we do and how well did we do it? So who did we reach? How much service did we deliver to them, and what do they think of our services? And those are things that charities should always be asking. And then we can do, and then those are the things we should always be asking. And then there are other questions. How much effect did we have? How much impact did we have that need more careful thought, and you should perhaps take on less often? We talked a little bit about stories and numbers, so the importance of both qualitative and quantitative information, and the idea of collecting a little bit of quantitative data from everyone you work with and a lot of qualitative information from a few people who are sampled properly so that you can generalize from their experiences, which is quite a good model. Taking advantage of technology, there's a lot out there and a lot of resources to use. It's kind of bewildering in some respects to approach, for example, if you're trying to establish a new CRM system, there's a bewildering amount of choice out there, so that's quite hard to negotiate. But on the whole, there are things out there, a lot of things out there that can help us, and it's important to take advantage of those. And then the final point really is something we suggest to all charities, which just is to see this as a journey. There aren't any quick fixes. It'll take time, particularly to build a culture around impact measurement, to build a kind of inquisitive culture, one that uses data and thinks about data and thinks about what you're trying to achieve. And it's fundamentally an in-house exercise. It's not something you can outsource to external providers. It's something the organisation as a whole has to grow into and to start doing itself. So that's everything I wanted to say. So I'm now going to move into the questions section to see what's there. So I'll stop sharing my screen so you can see me properly and see what we have. And do feel free to add questions. So first of all, I'm a trustee of an environmental charity, so we don't have beneficiaries in the traditional sense like this. And whilst we also contribute to change, it's hard to measure exactly how much of the changes are down to us. Any advice? Yeah, well, this is what I meant about different contexts have quite different implications for charities. And we're currently working with a few environmental charities who are facing this issue. It seems to me that most environmental charities are actually working through humans. So you're trying in some respects to raise awareness about the environment, to stop humans damaging the environment in different ways. So even though your final beneficiary is the environment itself, you're actually working, a lot of your work will have an effect on humans. So a lot of what I've just said about the 5 types of data remains relevant because you're still trying to change human behavior ultimately. But certainly when it comes to, if your environmental charity is, for example, literally cleaning an environmental area or setting up a new park or something like that, then your impact will certainly be, you'll be wanting to look at the effect of that work on various biological, zoological measures as well. So it kind of extends the theory of change further. It makes it more convoluted. But nothing that I've just said, I think, changes as a result of that. And the point you've made about contributing to change rather than causing it directly is exactly the point. If you're trying to protect a particular species, you will certainly do a lot of things which you think might protect that species, but there will also, within the outside world, lots of other things that are happening that will be either supporting or opposing your goals. So it is very hard to attribute any change that you see to your own activities. But that's the same for absolutely every charity, really. So there's no easy answer to that question. And what you basically need to do is, going back to the points I made, is make sure that the things that you're doing have a scientific link to the goals you want to see, as much as possible, as far as that's possible. So are the activities that you're doing, but actually both scientifically and intuitively going to cause the result that you want to see, and then to measure the results, measure your own performance in terms of what you're achieving as well as you can. And that's really all you can do. Jenny has written, a little from a lot and a lot from a few. Do you have any further guidance on what you consider a little and a few? I think we're always tempted to ask too much of people, or we're worried that we're not asking enough people for info to be reliable. Yeah, so a little from a lot is essentially as much information as you need to be able to tell people about the scale of your work. So how many people you have reached, for how long, and how often. So it gives you a sense of basically the number of people that could have been affected by your activities. And then a lot from a few is basically trying to understand the potential of your intervention. Okay, so from a few case studies, what might this intervention be achieving? How can it be helping people? In what ways can it be helping people? And to give you to provide an illustration of that happening. And in order to achieve that, or in order to get a good enough result from that, i.e. how many people we should be going to, it depends very much on the scale of your service. But if you can speak to 10 or 20% of your service users, and if they are selected randomly, then they're going to give you a fairly good impression of what kind of impact is being achieved. So that, I think, as a rule of thumb, 10-20% is probably what I'd say. But it depends. If you're actually talking to, if you're engaging with 10,000 people, that's clearly not possible. And so you could possibly go for a fewer. But if you're able to speak to 10, 20 people, you'll definitely get a good sense of what the potential achievements of your interventions are. Right, there's a few more questions in, but I've actually run out of time for my bit, so we can come back to these questions afterwards in the longer session at the end. But I'd like us to move on to our next speaker. So I'm going to share my screen again and introduce, once this is going, Nazmin Akthar. So Nazmin is the co-chair of the national award-winning charity Muslim Women's Network UK, which works to improve equality and social justice and end discrimination and abuse for Muslim women and girls. She's also the co-founder and co-chair of the international charity NISA Global Foundation, which supports women on the front line at a local level across the world in a bid to reduce poverty and abuse and improve health and education. She's a residential development lawyer, and Nazmin leads on legal and charity governance matters, both for charities as well as advising on law reform campaigns and consultations. So Nazmin, over to you. Thank you so much.
Thank you, James. And you'll be pleased to hear that everything I'm about to say is actually the theory of change in action. So hopefully everyone will learn from that as well and take some examples. Next slide, please. So just to dive right into it. So I'm the co-chair of Muslim Women's Network UK, which is a national charity based in Birmingham that works to promote equality, social justice, social inclusion, and racial and religious harmony. We work on over 40 different issues. So our work is very broad ranging, but some of the key issues that we work on and focus on is supporting victims of domestic abuse, supporting mental health initiatives, providing support to women trapped in Islamic marriages, and providing support to victims of discrimination. Now, I've said a little quote that Stylist Magazine once said about us and called us small but mighty. And the reason I've mentioned this today is that is exactly what is all charities can be and are. You know, even the smallest charity can be mighty if they can get their measuring impact right. So that's why I put that in as the theme, that, you know, if we can just take the little steps to start measuring and our impact, the impact we will achieve could be mighty. Next slide, please. So I'm going to start by giving examples of the type of work we do, and then explain how it all fits together and how it came about, and how the way we measure impact has led to the type of work we do and the achievements that we've made. So the type of work we do, on a frontline support basis, we run the National Muslim Women's Network Helpline. We provide a counselling service. We run the online hub, which is an online platform where you can contribute blogs, vlogs, you can start forum discussions, contribute to and listen to podcasts, leave comments, ask questions, anything you want to. Essentially, it's a community hub where you can connect to others and talk about anything you want. We carry out research, we hold training and events, we publish reports. We also do a lot of advocacy work, which includes campaigning, contributing to government consultations. That can be in the form of submitting written evidence, or it might be attending government meetings. And we're also secretary of the APPG on Muslim women. Now, I know that seems a lot, and you must think, well, how does all of this fit in? But this is what the theory of change led to. So we had an organization evaluation. In fact, in the last decade, we've had 2 organization evaluations now, where we had to, as James had just mentioned, ask the questions: what is it that we want to achieve? What is it that we are trying to achieve? If I could have the next slide, please. And the key question for us was, what does impact mean for us? What is it that we want to do, and how are we going to do it? And ultimately, I think our objective, and everyone's objective, is always the same in the charity sector. We want to achieve our objectives efficiently and effectively, because let's be honest, the charity sector does not have unlimited amounts of money. So we have to be smart. We have to use whatever funding we can get in the best possible way and carry on, so that we can, you know, support others. So I'm going to now, next slide, please. I'm going to now basically give you an example of how we work, and how that involves assessing impact, and how that leads on to the, you know, the achievements and the impact that we managed to achieve, the outcomes that we managed to achieve. So as I mentioned, we have the National Muslim Women's Network Helpline, and each year, without fail, we have an external evaluation of this helpline. So this isn't an organizational helpline. This is specifically for the helpline, looking specifically at the helpline data, so everything that's been recorded from the type of issues faced, demographics, the locations of where the majority of calls are from. Everything is evaluated, and the auditor then presents us with a report. From that, trustees and staff look at it and say, okay, what is coming out? What are the key themes? What are the decisions that we need to make from the findings of this evaluation? So one example I can give you in the recent time was one of our helpline evaluations highlighted that one of the key issues, and this was also echoed by staff throughout the year in internal evaluations as well, one of the key issues coming up was Muslim women's experiences in the criminal justice system. So when they were, you know, victims of abuse or discrimination, and had been, you know, had approached the police for support, or were in the criminal, in the court process, that kind of thing. And we realized that, okay, this is a key issue. One thing that we need to do more is provide more counselling sessions for the service users facing these issues, because just the helpline wasn't sufficient for that. And that is actually how the our counselling service actually came to light, because we evaluated not in terms of the criminal justice system work, but we evaluated that actually the helpline isn't enough to address some of the issues that are being faced. We need to provide another service. So the first step that trustees took was make sure there was, make funding available, resources available for the counselling sessions that were needed, which was the immediate impact that we had to address. We then realized that we need to carry out research, so we authorized research being conducted, and we published a report on women's experiences of the criminal justice system. Now, this report is a combination of quantitative and qualitative data. So what James had mentioned previously about, is anyone better off? This is where it almost came in, because we were taking the data that we have, that others have, conducting research and being able to say, this is the support that we gave and what happened had we not given the support, what the consequences would have been for these victims of abuse. And we also have recommendations in our report. So we say, these are the changes that need to happen. And that can be either at the stakeholder level, so within it could be within the third sector, it could be within the police, it could be law reforms that we need. So we publish this and we disseminate it. We then record who is accessing our reports. So if somebody emails to ask for a copy, we note that down. We record how many times it's downloaded online. So we can tell you that XYZ report has been downloaded 10,000 times. So we can see that there's already that impact and how popular it is or how relevant it is to individuals. Leading on from our research, we hold training workshops and events where we again raise awareness of the issues. We have discussions similar to this where we talk about good practices, bad practices, what we need to be aware of, what we need to change. And this could be with service users, this could be with other charities who are working in the field, this could be with stakeholder organizations like local authorities, CPS and the like. And this has also shaped our advocacy work, where one of our key campaigns now is trying to change the law around intimate image-based abuse and ensuring that the proposed law reforms are take an intersectional approach and understand the varied experiences of victims of abuse. And as part of our work, we've been liaising with the Law Commission on that. And at the same time, we have been making sure that our hub has information to do with the issues faced and the rights of victims and what they can do if they face similar hurdles and barriers in trying to access justice, and what they can and can't do. It allows and so we have these articles available, we're making podcasts available so that people can listen, they can talk to each other about it, so they can have these conversations, and they can do it anonymously as well. So it's a safe space. And we measure that too. We measure how many times our articles on, for example, intimate image-based abuse is being accessed, where even looking at when the peaks are. So is somebody looking at them in the morning and they're looking at them in the evening? Is there some sort of, reason why somebody might be looking at a certain time? We also look at, the type of comments that are being made. So it isn't just quantitative data, it is qualitative data as well that we're collecting. We're seeing what people are saying. We share these on social media, and then we see what people are saying when we share information about all of this on social media as well, and collect all of that. And the immediate impact from all of it is that it allows us to see that what we have done is relevant, is being used and being discussed, and we are sharing knowledge that needs to be out there. But it also then comes right back to the circle completes and goes back to the helpline, where somebody might have read our report and thought, okay, you know what, there is this organization here that can help me on my issues. I'm now going to contact them. Or somebody, might have been at a workshop, or somebody might have been on our online hub and read something, and then they call, they get the support they need. So that in itself is an immediate impact. We have empowered somebody to take that first step to ask for help. And that in itself is something that, for us is a big deal. And obviously then it continues, we provide them with the support they need as part of their issues. And, none of us are a business. It's not about when we talk about quantitative data, it isn't about, oh, how many calls have you had in a day, or how many, making sure that the calls are only 10 minutes, 20 minutes long. It is always about helping the person, but it's making sure that how we're helping them is actually making a difference, that we're not just on that phone for the sake of being on a phone call. We are actually doing all we can in that phone call to make that person's life better. If I could have the next slide, please, as well. So obviously I've given examples of how all our work fits in and the actual impact, the outcomes that arise from the work we do and the measurements. But from a governance point of view as well, and obviously all of that is governance related as well, because when me and my fellow trustees are deciding if we want to, commission research, we need to know, is it worth it? Is it necessary? Is there a need that we're fulfilling by, and is it going to achieve something that is going to be for the benefit of our beneficiaries, of our service users? Is it going to help our objectives? But it also helps us make other governance decisions that isn't seen in the outside world. The research you'll eventually see, the articles you'll see, but you don't see the back office stuff. So you don't see the recruitment that we carry out as the result of these assessments and valuations. If our evaluation makes it clear that actually, and in fact this is what's happened, we had shorter operational hours. One of our evaluations made it clear that actually that's not good enough for our service users. We need to expand our working hours, and we did. We recruited more staff. We did that. When this isn't necessarily with external evaluation, this also comes about with regular forum meetings with staff. As soon as, when there's really difficult cases to deal with, we know that, okay, we need to make provisions for staff welfare, because what they're dealing with, as they're on the front line, where the trustees watching and making the decisions, but they're on the front line dealing with it all. We need to make sure we give them the support that they need, and we even change our policies accordingly. As part of one research, we realized that it's, we'd made the recommendation in our research that it's important to have basically paid time off when, if your employee is suffering from domestic abuse and you find out, have provisions in place to, give them time off so that they can get the support they need, the time they need, and so they can be, take safety measures. Now, this is a recommendation that we made for everyone else. So naturally, we have to do that ourselves. So we changed our internal policies as trustees and said, yep, we need to do this as well. If any of our employees or volunteers, sorry, not volunteers because they don't get paid, but if anybody needs support, we have the measures in place. If employees need paid time off due to being in an abusive situation and needing support, we have the paid time off. If volunteers need any sort of support from us, we will provide them with that support. All of this helps. So measuring impact helps us to make better governance decisions, not just for our service users, but for us as an organization, as employers as well. And I strongly feel that all of this, by measuring impact, by proving impact, by showing that what you're doing isn't just ticking the boxes and fulfilling the numbers that you've promised a funder that you will achieve, but actually doing a lot more with it, it increases trust and transparency in the third sector, which I think is really, really important, especially now when the third sector is, more critical, more than ever, more important than ever in, making society a better place to be. So my tip, and if I could have the next slide, please.
Nazmin, just a couple more minutes now, if that's okay.
Okay, that's fine. So my first tip is broaden how you measure. So it's not just organizational evaluations. You don't always have to hire somebody else to evaluate, and so you can do external organizations, you can have internal organizational evaluations as well. You can do project specific evaluation. So our helpline is a project specific evaluation that's done externally every year, because that gives us so much information that it's worth doing. And then we have internal evaluations as well, whether that's of our workshops, of the helpline too, of everything we do. And as James has mentioned, we get feedback from everybody. We get feedback from staff, from service users, from partners, from the general public. And that should hopefully be the last slide now. My second tip of the day is measure everything. And by that, I mean not just evaluations and ensuring accurate data recording, but measure anything and everything. So to give you an example, our helpline, as I say, we have over 40 issues that we deal with. I think we're on 43 issues at the minute, or 44. And the top 5 issues are usually domestic abuse, mental health, Islamic marriage, divorce. So there are top 5 issues that we know that we have to look at. Discrimination is an issue that we deal with, but it's not in the top 5 in our helpline evaluation ever. It's there, but it's never the reason that people call us for support. Yet when you look at the number of reports that are downloaded, and when you look at the information that people give us at meetings, at events, at workshops, or even our hub, or even our social media activities, whenever we ask questions, have general questions about what matters to you, what's affecting you, discrimination and Islamophobia comes up all the time without fail. Even though it's not something anyone's calling us about, but it is something that they are approaching us and looking at our resources for, because it affects them. Now, if we hadn't added the measurement tool onto our reports to be able to see how many times each report is downloaded, we might not have known that this is a key issue affecting Muslim women and girls. And well, it's a key issue that matters and that we need to continue working on and campaigning on. So those are my tips. Measure, broaden how you measure, and measure everything. And I think I've run out of time now, so I will stop.
That's brilliant. Thanks, Nazmin. So if anyone wants to ask a specific question to Nazmin, then please just use the Q&A. I've got a couple, so I'll start off. So I talked about it being a bit of a journey, impact measurement, and I think all charities can put themselves somewhere along that journey. And it feels like, to me, you're relatively mature in that you've been, you've got a lot of things in place. You're getting the benefits of evaluation. You can talk about how it's helped the organisation. How long has it taken you to get to that place, would you say? Or...
Well, I've been a trustee for 10 years, and I would say the whole 10 years. And I still, our theory of change is ongoing. We still have, as like when you do evaluations, you decide on 3-year goals, 5-year goals, and 10-year goals. And we're still there. We still have more goals to achieve. We still have a lot more to do in terms of improving, measuring impact in achieving what we do. And the pandemic did make us change our plans a little bit. Plans that we had for aspirations in 5-6 years time, we brought them forward. And the plans that we had for the year 2020 to 2022, they've actually kind of moved away. So you have to, and that's part of the journey, that you have to keep evaluating for that reason. You have your theory of change, and then you have to see along the journey, okay, do we stick to the path that we have, or do we need to divert a little bit, or do we need to go up and down and move around? And that's the thing, as long as you are measuring impact and progressing, that's the main thing. And like I say, we still have a lot more to do, but the main thing is to start. Once you've started, even if it's a small measurement that you start with, when we started our helpline in 2015, we didn't have these amazing databases that we currently have, and now we have all the fancy portals and everything. Back then we had spreadsheets and obviously password protected laptops and that kind of thing, and we had to trustees had to be given folders by email. Now we've got all these amazing websites that we go into, and it's all super efficient and super password protected. But it's been a journey. But if we hadn't started in 2015 with the spreadsheets and the Excel spreadsheets, then we wouldn't be here now with all the technology that we do. And we still have a lot more to do in terms of technology.
So what would you say to someone who is sort of at the other end of this journey, is just starting out and trying to think about whether or not they should invest? Because it's quite a big investment, isn't it, of time and energy? Like,
it is.
how quickly will that pay off?
Okay, so the honest truth is that it's been a long journey, and it's taken a long time to get to where we are, because funding isn't always available for these, IT infrastructure type works in these measurement tools and everything. So, but you've got to start somewhere, and that is what I would say, that build on it. Start, if you've got, find a little bit of money, invest. Eventually, you will see the returns. We started with, like, to give you the example of the hub. We started with a very skeleton online website, so to speak. It was quite basic in the sense, but we thought, we've got the funding for this little bit of work, let's start it. So we started the website, then we found a bit more funding and we added another feature. We found a bit more funding, we added further features, and we developed the website, and then we found more funding and we recruited staff for it. It was all, it's a slow process, but it's now in a position where, we have an online community, and it is such an excellent resource. If I ever have a consultation that I want to respond to, a government consultation, all I have to do is go onto our online hub, type in the question into a forum and say, what are your thoughts on this question? Tell me. And obviously that then informs what I tell the government in terms of what our opinion is on the, whatever the issue is that we are consulting on. And that in itself is an impact that, okay, we don't know what will happen once this information gets to the other side. So there is a point where we have to unfortunately stop and say, okay, we don't know what the impact is. But being able to feed that information in itself is an impact, because had I not had all this data in front of me, I wouldn't be able to do that in the first place.
Great, yes. Thank you so much. We should move on to Jenny now. There is a specific question for you about how you present your impact measurement. So we might ask you if you've got anything in the public domain, if you could sort of share a couple of links to that in the chat, that'd be great.
Yeah.
But thank you so much. And now to our third speaker, Jenny North. Now, Jenny is the new director of the Clothworkers Foundation. She leads their reactive and proactive grant making across the UK. She recently joined from the Dartington Service Design Lab, where she was deputy CEO. She's worked closely with local authorities, funders and charities to support strategy development, service design and evaluation. Prior to Dartington, she worked at Impetus, which is a venture philanthropist supporting charities focusing on narrowing the disadvantage gaps in educational attainment and youth employment. There, she developed her interest in supporting organisations to focus on improving, not just proving, their impact. And she is also the non-executive director at the Youth Futures Foundation and the Social Investment Business. Jenny, over to you.
Thank you very much, James. Are my slides coming up? I'm sure they are. Yeah, thank you. That was part of what I was going to say to start with, which is that I am a very new director of the Clothworkers Foundation. I've been here just a month, and so a lot of what I'm going to be saying today shouldn't be taken as the official Clothworkers Foundation line on impact measurement for trustees. I'm drawing on experience from throughout my career. Well, as James said, my own experience as a non-exec or a trustee of the Youth Futures Foundation and the Social Investment Business. So I do come with experience as an exec. I've also worked for frontline delivery charities and for campaigning charities. So I'm coming with that experience. I'm coming with that trustee experience. And in my previous role at Dartington, I was working as an evaluator. So possibly I see things from too many sides. I know exactly how challenging impact measurement can be, both for the executive, who does the bulk of the work, for the trustees, trying to hold them account and stay abreast of what is very complicated work, and sometimes the external evaluator who comes in and is perhaps expected to sort of cut through the difficulties and provide clear answers. So all those experiences are informing what I'm going to say today, and I can see from the Q&A where you've introduced yourselves, and from the chat, that the organisations that you're representing are diverse, and they're diverse in their impact goals, they're diverse in their size, their sort of stage of development. Some of you, I'm sure, will be quite new organisations, some of you venerable and around for a long time. So you're diverse in sort of size and stage, and also in your stakeholders, so who you are feeling accountable to. For some of you, there will be funding from the public, some of you funding from local, national government, from private philanthropists or grant-making trusts. So lots of different sources of accountability in terms of where your money comes from, but also in terms of who you feel you are working for. And all these things will be feeding into the approach to impact measurement that will feel right for you. So those kind of, you as organisations are diverse. And I think what we've heard from James and Nazmin, all stuff I would totally agree with, and I'm probably not going to say quite as much as they have. My focus is going to, I think, be on the difference or the specific role for trustees in this issue. And I think the argument that I'm going to make is that clarity on your role is really helpful here, because it's very tempting, and I've sometimes have seen this in organisations, for trustees to think they can sort of step in and take this on as a bit of a project to save the exec who is busy and overworked. And I'm going to say that you can't do that. I don't think trustees can solve issues around impact measurement for their execs. It is squarely an executive responsibility, but of course it is also a strategic priority, and therefore something that falls under trustees' purview. So clarity on your role, and then clarity on the impact goals of the organisation, something that James has touched on already, and I'll come back to. Clarity on those goals, I think, can help to provide clarity on the impact measurement approach that your organisation should take. And I will say, having said that you can't do this for your exec, trustees are diverse, your organisations are diverse, and you're diverse. And it is natural and helpful for some trustees to lean in to impact and impact measurement more than others on the board, just like some might lean in more to finance or comms, and even provide hands-on support for execs, particularly if you are coming from a background. So I think that is really natural, and I sometimes do that on my organisations, but I'm talking about what trustee boards as a whole should understand about their organisation's impact and measurement, and what they should see as their accountability. So said that, if we can move on to the next slide. Thank you very much. So thinking about kind of just first things first, sort of checking priorities. And what I want to flag, I guess, and I'm sure you're all really aware of this, but I think it's most helpful to pull it out, is that in a healthy organisation, the executive care about what the trustees care about, and this should be vice versa. But the executive is, in my experience, very aware of what the board wants and what they care about, and this will drive the priorities of what the executive think about, what they spend their time on, what they put in their plans, and what they operationalize. And so the question there, I think, is what do you incentivize your executive to care about? And I put some things down that I know that trustees incentivize those execs to care about, and finance is at the top for a reason. When I look at the board meetings I have sat through in my time as both exec and trustee, there is a huge amount of time spent on talking about finances, both often how the money's coming in and how it's being spent. And I sometimes think that, although of course it's really important and it is one of the core responsibilities, the fiduciary responsibility on trustees, one of the reasons that boards spend so much time talking about it is because we know how to measure it. We have standards and methods that have grown up over a century, actually, of what good finance measurement accountancy looks like. And so therefore it is quite easy to talk about, even when the finances might themselves be complex. We don't have that kind of clarity around how to standards and sort of set ways of measuring impact. So I often see trustees who speak and talk a lot about the finances, of course, and that does lead to attention on that issue from executive. There are other things that I see trustees spending a lot of time talking about and thinking about. So reputation, how are we seen? Are we talking to the right people in for some charities, Whitehall and Westminster? Who can I connect you with? How can we make better networks and links and be well thought of? Are we growing? That's often a real obsession for trustees and execs and some funders. Are you growing? And the question of whether your impact is growing is sometimes not as important, it seems, as whether your footprint is growing and whether you're serving more people. You'll see organisations also thinking a lot about staff happiness, staff motivation, staff retention, and all these things are really important. Finances, reputation, growth, staff, they are really all things that funders, that trustees should care about. Sometimes I feel that impact against the mission gets a little bit neglected in comparison to some of these other things. And as I said, particularly in comparison to finances, even though, as James has said, it is a key responsibility of trustees to be aware of progress against impact against the mission, and to hold staff accountable for this. And so another reason that I think sometimes impact gets a little bit forgotten about in terms of where trustees spend their time is because it can be the hardest to talk about, not just because we don't have good ways to measure it, but because questioning whether a charity is making an impact is straight to the heart of why they even exist. And so talking about whether we're making impact, what we could be doing better, where are we not doing as well as we could, what's the implications of this, that can feel really personal, quite emotional, quite uncomfortable, but it's also the point of why you're all there around that table, and why the staff are getting up in the morning, and why you are giving up your time as a trustee. So talking about whether we are making impact is really, really crucial, and can't be overlooked, just because it is difficult, both kind of sometimes emotionally but also conceptually. So if we move on to the next slide. So just before I talk about the next slide, I suppose if I think about how do trustees incentivize focus on something, the obvious one is agenda time. What's always on the agenda at your meetings? What is in the chief execs or the senior staff's KPIs? What do you speak about in your one-to-ones with the chief exec? All these things are how you signal what you care about as trustees and where your focus is, and all these things have an impact on what the executive take as their steer from you. So I said that last slide was first things first, but in fact this slide is called first things first. And this, I'm not going to labour this slide because James has given us a lot of detail on this, and so has Nazmin actually. So way before impact measurement, there has to be intended impact. And I know you guys all know this, but sometimes it is just worth stating that a lot of people talk about impact measurement, but sometimes they don't talk very much about making the impact. And before you try to measure anything, there has to be something to measure. So the key to making impact, I believe, is to have a clear plan to how you're going to do it. Impact doesn't happen by accident. It's extremely hard. The problems that you are trying to tackle in your organizations are intractable. They are often the result of long established market failures. If they were easy to solve, the private sector would have done it a long time ago, because there would have been some kind of economic imperative for it. These are difficult problems to solve. So impact doesn't happen by accident. We need a clear plan. As James has said, I think, boiling down, James has already boiled down explanation of theory of change further. It's defining the change that we're trying to make, defining the activities we think will get us there, understanding the factors around us that will either contribute to that change alongside us or might get in the way, and we need to be aware of and mitigate for this. That is a very simple way of boiling down theory of change, and I think it's always important to remind everybody, myself always, that it is a theory. This is your hunch, this is your best guess. You might be wrong. There are probably some factors, as James said, that have already been established by an external evidence base. Even when we know that some things work, you might not be delivering them well enough for them to work. So always having that kind of healthy anxiety, I think. That what you're trying to do is difficult, that you have established the best hypothesis, the best hunch you can, and now you're going to see if it works, is an important kind of mindset to have on this impact measurement journey. But without clarity on this theory of change, on the change you want to make, how you think you're going to get there, impact measurement is frustrating, time wasting, and ultimately impossible. And I'm sure you're thinking, obviously, but as an evaluator and as a staff member, I have definitely seen people try and go down the impact measurement road, counting things, getting external consultants in, saying we need to prove that we work, without being very clear on what we are doing, on what we might be testing works or not. So without that clarity, it really is very difficult. So if we go on, please.
4 minutes.
Thank you. So I saw a couple of people asking in the chat about different types of organisations and what kind of impact questions are relevant for them. And I'm not going to go into detail here, partly because I want to keep this high level, because again, the exec has to go into the detail, the very low level detail that James talked about, but trustees can't really. They keep it at a strategic level. They haven't got the time to go into all that detail. So thinking about if you are running an organization that runs programs, time-limited programs designed to get people outcomes by the end of it, some questions that you as trustees might be asking and expecting to hear good answers on, or helping to come up with good answers on: what type of people are we fit to serve? What needs can we meet? And therefore, who should we be enrolling? And what outcomes are good enough at the end of the program? What will make us feel, yes, we've done a good job by this person, and what will make us think, actually, we failed? So understanding what outcomes are good enough. Lots of you will be delivering services that don't have strict end dates or strict goals. So people who are perhaps running hospices or supported accommodation. For there, again, you're asking what type of people can we serve? So what needs can we meet? And what standards do we strive for? We might not be saying, oh, you'll have a job at the end of this, or any of those kind of hard, easy to meet, easy to measure outcomes. Easy to measure, still hard to measure, but easy to define. But you can talk about what standards do you strive for? What does good enough look like in terms of the service that you provide meeting those needs? Campaigning organisations, very tricky area, but clarity on what are your campaign goals? Who needs to hear us? How can we tell if they've heard us? And then how will we know if they've listened? Some questions that as trustees you could ask. And if you are running a network or a systems change organisation, what responses in the system, what patterns, whether they're good or bad patterns, or kind of vicious or virtuous cycles, are we looking to change or strengthen or remove? What strategies we're going to use to make those systemic change, and how we know we've had an impact. Those are some of the questions that trustees can be asking of their execs and expecting to get good answers on, depending on what type of organisation you are. Next slide, please. So learning at the right level. Once you have those questions and the good answers to them, organisations can learn, and they can learn from top to bottom. But the learning happens at the right, has to happen at the right level within the organisations. And you know, as we've said, if you're coming at a trustee level, that's different to frontline staff. So frontline staff need their own data, and it can be it doesn't have to be very technical or very whizzy in terms of how it's presented, but they need their own data often to change tack with individual projects or clients. So they can see who, at the most obvious level, as James has talked about, who's turning up and who isn't, and what you need to do differently to get those clients to turn up. Something is not working for them. What is it? How can you fix it? Managers need data across their teams so they can see which staff or which projects need extra help, and they can also see who's doing amazingly and might have some great practice to share. Senior exec, less frequently, need aggregated data across teams. They can see where progress towards organisational impact goals are on or off track, and they can coordinate action and response. That action might look like doing more of something where it's going well, or putting more resource into something that is struggling, or doing different, saying actually maybe that hunch, that hypothesis we had was wrong, and we need to look at meeting the needs of our users in a different way. And then at trustee level, you are monitoring progress towards those goals, so asking to see that progress regularly at every trustee meeting, understanding risks to impact, and again, early warning of those risks is what you're looking for from your executive, and holding executive accountable to acting in response to learning. So expecting the exec to have a story to tell you about progress towards the impact goals, and to seek your support and your challenge in agreeing what actions they're taking in response. So learning at the right level is for me, one of the biggest promises of impact measurement. And moving on. So I just wanted to introduce a question that some of you might have in your mind of like, what this internal learning that you're talking about, is that impact measurement? And I suppose, no, if what by impact measurement, you're thinking of an external evaluation by a credible organisation that says, does X work, where your organisation's flagship programme is X. And that is often how people think about impact measurement, and it leads to that external evaluation. You're perhaps looking to go up what they call the standards of evidence, resulting in a randomized control trial at the very peak. But as I'm sure lots of you are aware, that's only one question you can ask of your impact, and it is really only right for certain organizations. So there are lots of organizations for whom a randomized control trial is always going to be not that relevant to finding out how valuable they are. And even for those organizations where a randomized control trial will be the right approach, they can only really engage in those at very particular times, and very rarely as well. So I would argue that the day-to-day collection and learning from impact data, and Nazmin gave some great examples of this, But that day-to-day collection gives you the best chance of understanding what you do, which as a trustee is really at the heart of your responsibilities. If you don't understand what it is your organisation is trying to do and how well it's doing in achieving that, that's you're failing against a key duty. Supporting the improvement of what you do. It's not going to be you doing the day-to-day work, rolling up your sleeves and making the improvement. That's the exec's job, but you will be able to understand what the improvement opportunities and imperatives are for your organisation, and to hold the trustees the exec accountable for doing that. It will give you amazing information to share with funders and peers. Coming back to James's point that the money is important, this work will give you the information that you can share with funders and peers to answer their questions about what is your value. And if an external evaluation, particularly a randomized controlled trial type or quasi-experimental design, is in your future plans, this is doing this work, using this work to iron out the things that are getting in the way of your impact, the best chance of being ready for external evaluation and actually getting proof of impact in that external evaluation. So it's not, I think this is the best way to approach impact measurement, unless you have been doing this already for years, at which point you can start to think about what's our next challenge. Moving on to the last slide, I think. Just a few rules of thumb. I guess I was trying to think what do I try and remember and often fail to as a trustee. Every year the exec, with your help, should have a plan for improving or at least maintaining their impact. And I say or at least maintaining because sometimes, for example, if you are going through big growth and you are moving to sites, just maintaining impact, just maintaining the quality of the service and the outcomes that you're achieving is blooming hard and should be applauded. Impact or progress against that plan should be on the agenda for every trustees meeting and visible in executive KPIs. As I said at the beginning, I think it's so important that trustees acknowledge often that making impact is really hard, and encourage the exec to share their failures with you. It is something that we don't talk about enough in this sector, is just how hard it is to make the transformative changes that we're trying to do. We take it as sort of like, that's the easy bit. If we get enough money, we can do that. It's not true. It's really difficult. And it doesn't help if we don't talk about it and acknowledge that. I think for trustees, that the attitude to take is, sort of supportive skepticism. Maybe skepticism is too hard a word, but, you've all heard dodgy impact claims, I'm sure 100 times in your work. Maintaining a sort of skepticism to big impact claims, but a supportive understanding of where they come from for your exec, and helping and asking the tough questions and making that something that happens openly in your organization is really important. And a final word, I think external help, i.e. evaluators, consultants, it can be transformative, but you need to be in the driving seat. I have seen too often organizations hand over too much power to evaluators and consultants in defining and measuring their impact, and the result is not that useful for them. I'll say no more.
Thanks so much, Gina. That's brilliant. Those are really good points there. I think from a board perspective, particularly the point about understanding that impact measurement is difficult. At NPC, the number of times we've had calls from concerned charities who've been asked quite unreasonable questions by their board. And there's a lot of work that needs to go into persuading boards to sort of see the difficulties, the inherent difficulties. So anyone got any specific questions for Jenny? If not, we'll move into the more general questions. I'll just pause for a second. Actually, while we're waiting, let's look at this first question we've got. So obviously it depends on how many different services you provide to different target groups. But realistically, how long would an initial impact analysis project take to set up and implement? So that's an interesting question. I'll either go answering it first, then I'll invite my. Nazmin, can you come on to the? Can you turn your camera on? So that we're a panel at this point. Yes, of course it does depend. It depends hugely on how many services you're providing, what size of organisation you are. And I'd say even in the best circumstances where you're a very small organisation doing one thing and you've got lots of data already, you'd still be looking at a 10-day sort of project or something like that. And that's best case scenario. And beyond that, really, I wouldn't even try to estimate how long it would take. And I think, Nazmin, if you were here, you would argue that actually it's not really something that has an end. It's something that you keep doing. I'm not sure if that's the most helpful answer to that question, but it isn't something to be taken on lightly or to be done superficially, I would say. If you're doing it sincerely, then it will take time and effort. Does anyone, either of my co-presenters, want to comment on that?
I do totally agree, and I think it's also like how long is a piece of string, depending on what your brief would be to either your internal team or your external consultants. I suppose what I would say is, if that feels too depressing an answer, you know, there are I think models for, like, you know, sometimes they're called hacks, where you can at pace, you know, or you know, work with your team. Again, I think this should probably be an internal effort. Work at pace to gather all the available data, however incomplete or unsatisfactory, on a specific impact question that you have. And that probably should be something like, you know, thinking of James's types of data, you know, who are we serving? Just as what do we know about who we're serving? Gather, you know, take 3 days for the staff to gather as much data as they can about that, clean it, present it in a way, come together and work out, well, what are we learning from this? What is no surprise? What is a big surprise? Where are we like, oh my God, I can't believe we don't even know this. Oh, that's interesting. Do we respond to that in how we enroll this group? Do you know what I mean? You could just do a very time limited, very unambitious piece of data work to whet your appetite and to give yourself a feeling of momentum. That might be a way, because otherwise, yeah, the strict answer to your question is, how long have you got?
Great. Okay. So the next question we should have a look at is, are there any key indicators that are used across the charity sector to give potential funders a sense of effectiveness? For example, percentage of funds raised spent on overhead versus the funds going to beneficiaries, or is that an out-of-date way of thinking about showing impact in numbers? So again, I'll do a quick response from an MP's perspective, which is we are not happy or would discourage you using that particular metric, because I think overheads quite mildly, well, they vary a lot depending on the type of organisation you are, and they're very prone to misinterpretation and misuse, so it's not a great indicator. There might be other indicators out there. I'm particularly keen to see charities using the Net Promoter Score. Would you recommend this service to a friend or relative? And the more charities that can use that as a key metric, the more insight we're going to have across the sector about relative satisfaction with services. That's early days in terms of getting that established. Do either of my two colleagues here have any thoughts on that question?
Well, I guess I can say something, as I'm actually a funder myself. NISA Global Foundation provides funding, and I think, well, I agree with what James has said, that it's actually less about, obviously we do look at overheads, we look at, you know, what it is, but it's always like my focus and my trustees' focus is on what is it that you're trying to achieve. So actually we're trying to instill this whole measuring impact thing right from the outset in the funding application. Like, we want you to tell us, what is it that you're looking for? You know, what do you think that you're going to achieve? And it can be quite, you know, qualitative achievements. Just so if somebody's asking us for funding to provide training for, you know, however many women so that they learn a life skill, but and that life skill could be, you know, first aid training, or it could be, you know, swimming lessons, that kind of thing. But we want, and we ask for the, you know, the financial breakdown of it all. Yes, we will look at, okay, how much is, you know, going to be spent on overheads and stuff, but as long as it's justifiable and we can see how, you know, what's happening and the reason for it, then that's fine. I think we do need to go you know, move away from this whole percentages idea and look at more about impact, you know, what is going to be achieved. And actually, if the funding is going to be to hire somebody, so which is, you know, staff salaries is an overhead, but if that funding is to actually hire somebody to provide support or assist in a particular way, then that's fine, because that in itself is the impact.
Yeah, I really agree with that. And I would come back to saying, if those questions feel meaningful to you as a trustee board, if you feel like I'm shocked at the level of overhead funding and we're doing an organisational drive to get it down, then that's a really useful thing to measure. If it doesn't feel meaningful to you, I question, don't measure it. And if you're not going to act on that data, definitely don't measure it. And from a completely cynical view, I have never seen money follow those answers. So do you know what I mean? Like when I've seen charities give amazing looking answers for that, I don't necessarily see that funders go, oh, okay, well, we'll give you more money then. So from a completely cynical point of view, it's not worth it. You're mute, James.
As always. So thank you very, very much for that. Next question is more of a methodological one. How to move away from survey and focus group fatigue. I will say one thing, which is to keep your surveys absolutely as short as possible. And then I'll pass over to my colleagues for any comments on that question.
Yeah, and I'm often appalled by how long and inappropriate sometimes, and actually counterproductive, validated surveys are, particularly around sensitive areas around mental health and well-being. So sometimes I have had to steer clients in the past away from very validated, respected, or they steered me away, surveys because they just were not appropriate to ask their vulnerable young people or vulnerable clients. So yeah, I don't have a good answer for this. I think brevity, particularly if you're looking for information that maybe is about your reputation and profile. What that one question that James mentioned, the Net Promoter Score, about is a way to cut through all that. How much did you like us stuff that is not that interesting for people to answer. When it's about their needs and experiences, again, I think a little from a lot, and as James said, a lot from a little is key. And make it worth the while of people that you are asking in-depth questions to, in terms of maybe recompensing them, but also taking their answers seriously and doubling back to them to show you how you use that information, so it's not purely extractive, but also they can see the impact they've had. Not a great answer. Survey fatigue is real.
I think I would want to add is also think about who is asking the questions as well. If you're going to ask the facilitator of the workshop, for example, to carry out the service as well, how much that information might be very different to somebody else who hasn't been part of the process asking the questions. We have now and then trustees actually take the feedback, so we will get involved and say, actually today, obviously not all the time, but sometimes I think actually we want to find out what is being said so that we can report back to the trustees. And I find it quite interesting what they're willing to say to us as opposed to what they might say to other staff members. Sometimes there's no difference, it just depends on the individual, but what I'm saying is it's good to mix it up sometimes and think about what you might get from having two different people ask the same questions.
Yeah, definitely. And I think, actually going back to one of Johnny's points, is keeping the questions relevant, but like making sure that they are meaningful to the people you're asking. They're actually the sorts of things they want to talk about, they want to tell you about, is another good tip. So we have 1 minute left or so to answer a particularly tricky question, which is what ways are possible to measure longer term impact. Remember I said that the impact needs to be something sustained, it's your legacy. So how on earth can you measure that? Well, I think the thing to understand is that when we talk about inherent challenges, that is one of the key ones, that if you're trying to achieve, particularly if you're working on things that are difficult, like keeping people out of prison, helping disadvantaged young people to do well at school and education and work, these things take years. And so you are in the position, if you want to measure those things, you want to measure success, you do have to find some way of keeping in touch with people. Occasionally in some settings, you might be able to find data from institutionals. The government has data that's hard to get at, but it's there and can sometimes be deployed or used or accessed to look at your beneficiaries. If you're interested in that, then look at our data labs work. Aside from that, then I think you're in the business of doing some quite serious social research in which you have to get people's contact details, be prepared to incentivize them to get them to respond to you, and essentially focus your attentions, your efforts on a smaller group of people who you can spend the time to stay in touch with and not try to stay in touch with everyone is another good strategy. And this is the point I made about using qualitative research. It's more feasible to stay in touch with a small group of people over a longer term doing qualitative research than to spread your efforts too thinly. So that's another way of trying to do this. But I think unless you've got the funds, then you have to be fairly realistic about what you can do here. Any thoughts on Jenny or Nazmin on this question?
I suppose just devil's advocate, so I agree with everything you said. The people who stay in touch with you are more likely to be the people who've had a good experience. So it wouldn't pass muster on for external evaluation, but it's extremely useful at that kind of day-to-day learning a level to stay in touch with the group and understand what happened to them afterwards. But yeah, I mean, that accountability line that you showed, James, in the theory of change, that's something to really pay attention to. What that means is, what can you realistically be held accountable for knowing and learning about on a year-to-year basis even. Wait till some big work centre comes along and flashes the cash before you worry about how you're going to...
That is an important point. It's not charity's job to answer a lot of these questions, really. Think about what is information is going to be useful to you, rather than what other people are asking you, and a lot of the time it's well beyond your. For example, it's well beyond an individual charity to say how much difference mentoring makes to people living in prison. To prove the difference, to prove the impact of mentoring. That's something that the sector as a whole might try and take on, or the government might take on. But for individual charities to do that is unrealistic, and it's risky if you try and take that on. You can waste a lot of time and effort.
There are ways you can strengthen your likely impact through that more granular learning, for sure. Yeah. And
if you focus on the shorter term effects, like are people coming back? Do they feel that positively?
Exactly.
Do they feel that they trust your mentor or their mentors? And these are all signs that things are going well, and that's what I want to focus on. But we're over time now. I just want to make sure, Nazmin, did you want to comment on that question, or are you happy with what we said?
Yeah, no, happy with what you've all said.
Great. All right, well, I think we're out of questions. And so thank you so much, everyone. I hope it's been a useful session. It's a huge topic, a controversial topic at times, but one that we're all all three of us and everyone at NPC is sort of inspired by and engaged in. So we do continue to believe that impact measurement, broadly defined, is a very useful thing for charities to engage in, and a very important thing to charities engaging. So hopefully from today you've gained a bit more of a sense of how we think about these things and how you might yourself be able to take it forward. You're going to get an email to follow up with some slides, a recording, and also a survey that we'd like to do. That might get posted in the chat as well now. I think it has been. Yes, it has. So do please feedback. We're very much interested in your own thoughts on our work. And we have another of these seminars in May on diversity, particularly around evaluation. So that's a really interesting and key topic that we haven't picked up today. So do come along to that as well. Yeah, and that's it, I think. So just thanks very much, particularly to my panelists, Jenny and Nazmin, thank you so much, but also to the rest of you for listening and for asking questions. Thank you.
Thank you.